Physicians can make a great difference screening for age-related driving disorders in older patients. With me is Dr. Linda Hill of UCSD in California to explain to me what her take-home message is for physicians regarding screening and identification of these patients at risk.
Data suggests that women outlive their driving by 10 years and men by 6 years. So at some point we're going to have that conversation with our patients, as difficult as that is. The good news is that the AMA has done a really good job of outlining how to screen for age-related driving disorders, and they've identified 7 tests to look at the 3 main areas that affect driving, which is vision, cognitive function, and frailty. It's interesting that frailty in of itself is predictive of the bad outcomes we're concerned about with driving, which are citations, crashes, injuries, and deaths. Cognitive function and vision is a little more intuitively obvious.
Can you tell me why acute hospital discharge is a time when patients are particularly vulnerable to these sort of driving disorders?
Very little studies have been done looking at the hospital setting as a place for screening for age-related driving disorders, yet we know that people develop acute illnesses and present in the hospital with conditions that are going to put them at risk during discharge. We did a study where we looked at almost 900 people in the inpatient setting and screened them for age-related driving disorders and found that almost 20% had failed at least one of the tests that we were looking at.
Dr. Hill, I know some states have mandatory reporting. Can you address why that's an issue?
9 states in the United States require that physicians report patients who are at high risk for driving debacles. And most states define these conditions as lapses of consciousness, which includes the things you would expect, like seizures and syncope, but it also includes dementia. What we found is that most physicians aren't aware that they have to report dementia. And like the reporting of many other public health conditions, this is vastly underreported.
Now, if a doctor wants to report one of their patients because they're concerned to the DMV, can you tell me how they do that?
The reporting occurs in the usual mechanisms, either through the public health department in the way that we report infectious diseases, or directly to the DMV. The good news is that the DMV has a process for evaluating these older adults, and we can tell our patients, just because I'm reporting you doesn't mean you're going to lose your license. For example, in patients with mild dementia, the DMV wants to know about them, but they don't necessarily lose their license. They just want to follow them more closely. So we can reassure our patients in that regard.
This has been Damian McNamara with Global Medical News Network at the Gerontological Society of America annual meeting.